Hey guys, it's Erin from Metasolve, here to review the new TKA PRO-PM, which is required under the CMS IQR program. So let's begin with the acronyms. PRO-PM stands for Patient-Reported Outcomes-Based Performance Measure. It is a measure type, and the very first time that is required in the CMS Inpatient Quality Reporting IQR program is with the measure called the PRO-PM TKA. It is following elective procedure of a TKA, which is Total Hip Arthroplasty and Total Knee Arthroplasty. So what it attempts to measure is your hospital's improvement to a patient's reported pain and function following an elective primary total hip and total knee procedure. So this is the first time that it's required in the IQR program, and you have to submit two things: the pre-op survey responses from the patient and the post-op survey responses from the patient. So let's dig into the measure. The heart of your PRO data will be two standardized forms: the WHO's Junior form for THA patients and the COO's Junior form for your TKA patients. You should already be familiar with these surveys. You must survey the patient before surgery and then again after surgery. In addition to submitting survey data in the pre-op file submission, you must also include 3 patient or provider reported risk variable screenings. One is the mental health screening, and you can use the PROMIS Global or VR12 screening tools. The other is the health literacy screening called Single Item Literacy Screener. And finally, the quantified spinal pain screening called the Oswestry Index Questionnaire. You must collect your PRO data within 2 very specific windows of time. Your pre-op survey data in the PRO survey and risk variable data must be collected 0 to 90 days before the procedure. The post-op data, which only includes the PRO survey data, must be collected from 300 to 425 days after the procedure. So the timeline for the mandatory reporting period looks like this. Once all that data is collected, CMS will compare each patient's pre-op WHO's COO's survey to his or her post-op survey to calculate the change in the patient's pain and function score. A patient's change in score must meet or exceed a minimum substantial clinical benefit threshold in order to be deemed a success. The threshold is slightly different depending on which survey the patient is taking: 22 points for the WHO's survey and 20 points for the COO's survey. CMS will then factor in all risk variable data you submitted, as well as your claims data, to create your final risk standardized improvement rate, also known as RSIR. If, for example, you achieve a 60% RSIR, that means in general, 60% of your patients reported a substantial improvement after their TKA procedure. And one last thing to note, this is mandatory, as I mentioned, which means if you don't submit or miss a submission, you risk losing 25% of your annual payment update. And furthermore, this data is publicly reported. So that's it for the basics of the TKA Inpatient PRO-PM. If you want to find out any more information or learn a little bit of how Metasolve can support your submission in this category, please visit our website at metasolve.com.